I'm Dr. Bonnie Weiner. I'm the Chief Medical Officer for Accreditation for Cardiovascular Excellence.
My name is Chandan Devareddy. I'm the Associate Professor of Medicine of Interventional Cardiology at Emory University.
I'm Timothy Ball. I'm the Cath Lab Medical Director at Virginia Tech Carilion Medical Center.
My name is Jane Kaya. I'm the Director of Invasive Services at Miami Cardiac and Vascular Institute.
My name is Joe Babb, and I'm from the East Carolina Heart Institute in Greenville, North Carolina.
I'm Peter Blanc, and I'm from Emory University Hospital.
Hi, I'm Chris White. I'm the Chief of Cardiology at Oxnard Clinic in New Orleans.
My name is Charlie Chambers. I'm past president of the Society of Cardiangiography and Intervention.
My name is Ken Rosenfield. I'm the president-elect of the Society for Cardiovascular Angiography and Intervention.
One of the things that we're frequently asked is what value does the accreditation process bring to hospitals?
Coming from an academic institution, when we first heard about ACE, I think our initial reaction was, do we really need this? We're an academic program. We think of ourselves as a center that serves as an example to the community and in teaching fellow physicians that go on to practice interventional cardiology at other institutions. But the more that we learned about ACE and got involved with the process, we learned that we had a lot of room for growth, a lot of room for improvement, and the ACE accreditation process really forced us to look at ourselves, look at how we can improve, and think about where we want to be as a cath lab program.
In the beginning, I was a little skeptical about the cost-benefit ratio. I was concerned that we might be spending a lot of money with little input and little reward. However, once we got started on the process, I realized that the rewards were far greater than were the costs. We were able to revitalize our cath lab, to improve processes, to improve conferences, reporting, and to improve overall our cath lab reporting templates and the like. All of these things were designed to meet the high standards of the ACE accreditation, and all of these things made our cath labs, our interventions, and our data reporting better.
We justified the cost of ACE accreditation essentially by being able to differentiate ourselves and convincing our administration that the data would not be for naught. We would drive improvements in our quality and show the benefit of the accreditation through better outcomes. We've also seen a reduction in denials, and so with that alone, that has helped to pay for the cost of accreditation.
To be recognized as a leader in a particular area is certainly worth the price of accreditation. With respect to outliers, issues within the laboratory that might lead to things like external investigations, would certainly make an accreditation process more than pay for itself.
And eliminating unnecessary variation from lab to lab is critically important. Making certain that your lab is obtaining the benchmarks that it needs to obtain, is up to the standards of other labs, and enhancing one's processes in the labs is becoming incredibly important to ensure that we are offering the very highest quality of care for our patients, monitoring our outcomes, improving our processes, using best practices. All of this is encompassed within the accreditation modules.
You learn a lot about what the deficiency in your cath labs are, even though you may not think that there are there to begin with.
In my experience, unfortunately, the internal review is also fraught with issues of competition, personalities, difficulties that make it hard for me as a reviewer to be coldly objective about my thoughts and assessment. But the external review process, someone similarly qualified, removes all of these issues from the table. And now we're just looking at the performance. Why was this procedure done? How was it done? What was the outcome? Is everything A-okay, or could it be improved? So I think the external review process gives us a chance to move this process forward into a better, more objective, more productive realm.
Bring someone in from the outside and takes away the conflict of interest which may be apparent if someone questions an internal peer review process. That's not to take anything away from internal peer review. That's critical as well. But the external review takes that away and also takes away liability, because it really has someone from outside who comes in and gives the word as to whether or not the review process is adequate.
Remember that ACE is not a policeman, it's not a police force. ACE comes to help you with your process to ensure that you provide the best possible care to your patients. ACE acts like a coach. ACE can coach you up to be the best possible team, provide the best possible care for your patients.
ACE offers not only an assessment of a program, but also a process where you can improve without a punitive component.
And in our increasingly complex systems of care with guidelines, appropriate use criteria, and such, it becomes a challenge for all of us to practice at this highest level in keeping with this evidence-based and expert opinion-based set of guidelines. Well, peer review gives us a chance to do that.
We now take exceptional pride in the fact that we have the ACE accreditation label for our cath lab. We think that in our mission as serving as a teaching institution, but also as a best quality practice institution, the ACE label really stands up as an ideal for all of those missions and for what we want to achieve as a program, and to help us serve as an example for cath labs both in our community and around the country.